Idaho Matters podcast is brought to you by St. Luke's On-Demand Virtual Care, which allows patients to see a provider from their home using a computer or smartphone with on-demand care for common ailments, such as a cough, sore throat, or a sinus issue. More information at stlukesonline.org.
Do you ever feel like you just don't have the time to sit down and read the news every morning? Sometimes things get so hectic you can't even scroll through your feeds while you're trying to get ready. A podcast from Boise State Public Radio has you covered. I'm George Prentice, and I want to invite you to check out The Connector every weekday morning. You can get up to speed on all of the Idaho news you need to start your day without ever interrupting your morning routine. All you have to do is hit play. That's The Connector from Boise State Public Radio. Find it wherever you get your podcasts.
From the studios of Boise State Public Radio News, I'm Gemma Caudette. This is Idaho Matters. There's an uptick in whooping cough cases across the United States. New CDC data shows infections are higher than this time last year. In fact, in Whitman County, health officials in Pullman, Washington, are investigating a whooping cough outbreak at Washington State University. It's Wednesday, which means Dr. David Pate is joining us today. He is the former CEO of St. Luke's Health System and a current member and also the author of the book, Preparing for the Next Global Outbreak. And if you have a public health question, send us an email, idahomatters@boisestate.edu. Hi, Dr. Pate.
Hi, Gemma.
Okay, so Dr. Pate, remind us once again what whooping cough is. It is also known as pertussis.
That's right. So this is a vaccine preventable disease. The vaccine that we have has been in use for many decades, very safe, and is, as you said, it's called the pertussis vaccine. And pertussis, or the whooping cough, is caused by a bacteria. And so typically it's spread by coughing, sneezing, and you spread this bacteria. Then people will typically start to get like runny nose, sore throat. But if we get it early enough, we can treat it with antibiotics. And if not, then it generally goes into this very severe coughing phase where people will have what they refer to as coughing fits. Sometimes so much coughing that they end up vomiting. Where it gets its nickname, whooping cough, from is particularly in small children who get infected in this, because it will involve their lower airways, which are not big to begin with. And then when they cough, they'll have this coughing fit, but then they'll take in a deep breath and it sounds like a whoop. And so that's how we give them the name.
So, Dr. Pate, as I mentioned earlier, the CDC is reporting an uptick in cases. I think more than 39,000 cases this year. And in fact, Texas just reported their highest number of whooping cough cases in more than a decade. So do we know why we're seeing such an uptick?
Well, I talked to an infectious disease specialist friend of mine in Texas who verified that they're seeing very, very high amounts of this right now. And of course, we think it's the combination of, one, fewer and fewer people are getting this vaccine and staying current with this vaccine. And two, because those people are around a lot of other people, they are spreading the infection. And we're seeing more cases of pertussis.
So talk about spreading it. I mentioned that health officials in Whitman County, Washington, are looking at an outbreak at Washington State University. They're calling it an outbreak. In fact, as of last week, there were 5 confirmed cases in students who live off campus. How concerning is this, Dr. Pate, that we're seeing this on a college campus?
Well, the college students, they'll have a miserable go of it, but they typically do well and recover. What is the worrisome thing about it is November 19th. We're 1 week away from Thanksgiving. And what we know is that means there's going to be a lot of travel. There's going to be people returning home where there may be infants, there may be pregnant women, there may be elderly. And what we know is that with pertussis, children under 1 year, this can definitely be a threat to their life. And so if there's small children, babies around, that's going to be a big risk. This can be very bad for pregnant women. It can be bad for kids that do have asthma, and of course for the unvaccinated. So the big concern is that, one, in a college setting, there involves a lot of close gatherings of people. So that enables a spread. But then pretty soon, if not already, they're going to be jumping on airplanes and heading home.
Well, and speaking of that, Dr. Pate, health officials in Whitman County are telling people who are infected or who are starting to show symptoms that they need to take a 5-day round of antibiotics, and then they need to isolate until they finish that round of antibiotics. But as you just mentioned, Thanksgiving is next week. WSU's Thanksgiving break actually officially starts next Wednesday. I am wondering how many people are going to heed that advice, right? I mean, a lot of these kids haven't been home since August. And I can see parents even being like, well, just get in your car, drive home. But how important is it that people do what these health officials are saying? But I mean, I'm just thinking they may not be following it as closely as maybe they're being advised to.
Well, you presented that very nicely. However, I am less optimistic than you are. It's very important that people that have this infection both take the antibiotics to prevent them getting worse, and also that they isolate, because this is fairly contagious. It's not one of our top most contagious, but it's pretty contagious. You don't want to be exposed in close proximity for a period of time. And so it's important to isolate. But, think back to being a college student when you thought you were immortal. Think about the current environment in which it seems like fewer and fewer people care about other people. And I think this is a recipe for disaster. I think that people will underestimate this, and we'll end up with a lot of spread of this on airplanes, at holiday gatherings. And then again, I think what we're going to have to worry about is these youngest of children, those less than a year, those persons that also have asthma or underlying asthma, and pregnant women. And this can be quite serious.
Well, and we should note, a lot of people know this already, but WSU is 8 miles away from Moscow, where the University of Idaho is at. There's a lot of commingling, right? That the airport is the Moscow Pullman Airport. I mean, people will get on the same airplanes. With that said, Dr. Pate, I mentioned this round of antibiotics that if you are symptomatic or you're infected, you can take. So is this the proper round of what you should be doing, I guess, if you are symptomatic? Is there is treatment?
Yeah, right now we haven't yet gotten to the point where we have a lot of circulating respiratory viruses. Some years we do have a lot of things circulating. And so if somebody got sick, it may be much less certain. But if you get these symptoms, and like I said, typically it's going to be runny nose, sore throat, maybe a mild cough initially, maybe fever. If you're getting that symptom and you are in the area of an outbreak of pertussis, like we just talked about Texas, we just talked about Pullman now, and so if you're in those areas and you have these symptoms, given that a lot of the other respiratory illnesses, RSV, influenza, COVID, are lower, then yeah, that increases the chance this is what it is. You need to get into the doctor, get a quick test, get put on the antibiotics, and then that should be good. What a lot of people don't understand, if left untreated and this progresses, people sometimes are left with a really nagging, persistent cough for weeks to months. So this is not to be sneezed at, pardon the pun.
And we should also talk about the fact that here in the Treasure Valley, we know at least of one case at a Boise high school. And we know this because some of us got a note about it. So what should folks be doing if, let's say there's been an exposure at your child's school? Is there any, because of course, because of HIPAA and all of that, we don't know, who these kiddos are. We don't know what classes they're in, et cetera, et cetera. So what should you do as a parent if you find out that maybe there is a case at your child's school?
Well, I would start with my advice to parents is, first of all, check with your child's doctor or pediatrician and make sure that they are current on their vaccinations, including the pertussis vaccine. Usually we give that pertussis vaccine in combination with diphtheria and tetanus. So just check with your doctor's office, make sure that your children are current with their vaccines. If you have someone in your family who is pregnant, especially if they are due to deliver in the next few months, when we will be right in our big respiratory season, there are a number of vaccines that should be highly considered to protect both mother and unborn baby. And then also, if you're expecting a baby in your family and you're the father, you're the grandparent, you're somebody who is working in daycare, or you're going to be a nanny for this child, then you're going to want to check and make sure that you are up with your pertussis, because if you get infected and then you're close with that baby, pretty good chance you're going to infect that baby. And again, for that baby, this can be life-threatening. And otherwise, if you're notified of an outbreak and your child is current with the vaccine, it's not 100% protection. So if they do get symptoms, get your child into the doctor and do alert your doctor of the fact that there was a case at their school or some other exposure that would mean that pertussis should be up higher on the list.
And Dr. Pate, for folks who didn't get a chance to listen last week, I want to touch again on the flu and flu shots, because this is the time here locally for folks to get those flu shots, correct?
That is right. And the other thing that we talked about, Gemma, was the fact that we have a concerning development, and that is that in the countries that I've been monitoring, where I get my advance warning of what to be worried about here in the United States, as they go through their flu seasons, we saw a very troublesome type of influenza virus emerge to be predominant, and that is an H3N2 virus. And the reason that's significant is, first of all, most of us haven't been exposed to that virus in probably 3 years, so we're not going to have a lot of immune protection. You really need that influenza vaccine this year. You should get it, as you just said. Go ahead and get it now. And the other thing is that H3, unlike the normal one we usually get every year in H1, tends to cause much more severe disease. So we have to be worried about children and adolescents, and we have to be worried about the elderly in particular. But as you and I talked about in a show weeks ago, there's also, for people in their 40s, 50s who get influenza, there's an increased risk of heart attack and stroke following influenza, as well as Unfortunately, we do see people develop bacterial pneumonia sometimes as a complication that can be life-threatening. And in fact, I know someone that passed away that way. So get the flu vaccine. And I didn't have very good data for the U.S. because of the shutdown, but I did just check this morning, and the data has finally been updated since September now. And unfortunately, that virus I told you I'm worried about, the H3N2, is actually the predominant one circulating in the United States. So I think this is going to be a bad flu year. We haven't officially entered into the designation that we used for flu season based on the activity, but we're darn close. I think the CDC will probably declare it in a couple of weeks from now. So it's coming. Go ahead and get your flu shot now if you haven't already got it, and don't forget your children. Any child 6 months and older, please. You may not think that flu is anything more than a cold. I want to tell you that is a dangerous assumption.
I got it once in my 20s, and that it was enough to make me realize I needed a flu shot. So
same here.
And we should be talking next about the bird flu, or H5N1, because it is on the move and it's hitting millions of chickens and turkeys, even ducks, all across the United States. Now, scientists are concerned not just about the virus itself, but that tracking and testing have slowed down at the federal level. So, Dr. Pate, we started talking about this. I'm kind of dating ourselves, about 2 years ago, I think. But can you start this conversation out by reminding us what bird flu actually is, and why are we seeing these outbreaks in birds right now?
Yeah, so bird flu, or as scientists would call it, avian influenza, is a serious consideration, not only because of the havoc it can cause in domestic poultry, and especially when we get what we call a high pathogenic avian influenza virus, which the H5N1 that you just mentioned is. And what we mean by that is when that infects, for example, chickens, which is very common, then what will happen is they are so packed together that they will widely transmit it. And this virus infection almost always leads to their death. So it means that you get these outbreaks of this virus, and then to contain it, typically you end up culling all those chickens, or it could be other birds like turkeys. We actually last year had a case in an emu here in or emu, or one of the alpaca, I think it was. Sorry, I'm not great on animals, but alpaca, I believe. Here in Idaho, and so it can wreak havoc that way. But what the concern for humans is that if you look back to all of the influenza pandemics that we've had in this country, most people are familiar with the Spanish flu back in 1918, 1919. That was very, very deadly. Some people may remember the swine flu, and we had our last influenza pandemic was in 2009. But these almost always start with an avian influenza or a bird flu virus that then mutates to the ability to transmit to humans and then spread among humans. Now, those are some big steps, and that's why we don't have influenza pandemics all the time. But when we have them, humans are getting exposed to an influenza virus that we generally have not seen, which makes it very, very dangerous. And so, as you said, we started monitoring this situation on your show when we had outbreaks of this virus in cattle in Texas. And we had a rancher that was infected with it. And then we saw this spread from herd to herd around the country. And then we started seeing between last year and early this year, we had 70 cases in the United States. Now, fortunately, when people are getting it from dairy cattle, it appears that it is not causing severe disease. Normally, when we have seen outbreaks of this particular virus, the H5, in Asian countries, the
Mhm.
mortality has been in excess of 40%.
Oh,
And as high as 80. And so that's why you should not think of this like a cold. Colds don't kill that high a percentage of people. So this is what's got concern. Now, at the same time, though, we started also seeing fewer numbers, including this latest case that you're mentioning, of
mhm.
people, but more cases that are transmitted from wild birds or domestic or wild birds to domestic birds and then to humans. That seems to be altogether different. And these people seem to get extremely ill, as is the case for this person in California. So that is a concern. The last thing I'll mention about why this one is a concern is during the past 5 years, you and I have talked about the mutations, the frequent mutations that the SARS CoV 2 virus goes through and all the new variants. Influenza does something even bigger. These viruses will swap whole big chains of their DNA, or I'm sorry, their RNA among them, and so that they can radically change because it's not just one particular part on the gene. And what we have now seen is this case that you were referring to in California is actually an H5N5 virus, which is the first time we've ever seen that in a human. And what it tells me is that these viruses are circulating around together and they're co-infecting either animals or humans or both, and therefore going through more change. I get worried about change because if an avian virus isn't a particular threat to humans as it is, you put it through enough changes and it can become that kind of threat. And
Mhm.
of course, as you and I have been discussing, now with the Trump administration, they've been laying off most of the people that do these investigations, most of them that do this research, cut the research funding for it. We are more vulnerable from the national response standpoint today than ever in history.
So, Dr. Pate, let's talk about this case, and I think it's in Washington State, I believe,
That's
because
correct.
this is the okay. So this is the first human case in 9 months. What I read recently was that their health officials are they haven't officially confirmed it, but I mean it's likely the bird flu. So with it being a different strain, as you said, um, I mean, how concerned should we be about seeing more cases like this? Because you mentioned, right, it's that change, and we saw this in COVID as well, right, where it's evolving and changing.
Yes. Well, I don't expect to see a lot of spread from it. If we do, that is going to be alarming. But we need to be on the lookout for it. And as you said, this case is in Washington State. I'm not real familiar, but it's in Grays Harbor County.
Yeah.
And this person had a mixed backyard flock of domestic poultry. And what appears to have happened is wild birds have intermixed with that backyard flock, which is what happens. It's pretty hard to keep wild birds out, and whether it's to share in the food that's being put out for your backyard flock or whatever reason, they typically mix, and it's the wild birds that can transmit this virus to your domestic birds, and then either can then transmit it to humans, although it's not highly transmissible yet. So we're thinking that's very likely where this person got it. Now, what is concerning, although that is an older person and that person does have underlying health problems, this person's been in the hospital now since the beginning of the month. So this is a very severe illness, and I'm certainly praying for that person. But what we are seeing right now that will make me more concerned about this situation is migration. So these wild birds that are up here in Canada, Washington, Idaho, will start migrating south soon if they haven't already started. And now the problem is they will carry the virus with it. And what I expect to see over the next few months, I wish it weren't so, but my guess is that you and I will be seeing many more reports of this avian influenza now infecting flocks and perhaps cattle in progressively moving to the more southern states.
And we should say, so Grace Harbor County is near where I grew up, actually, Dr. Pate. There are the towns of like Aberdeen, Hoquiam, Montesano, Ocean Shores, Elma. It's kind of a lot. It's frankly, it goes right to the coast of Washington State if people are concerned. So not that far away, folks, from where we live here in the Treasure Valley. I have less than a minute left with you, Dr. Pate. I do want to quickly talk about the lack of a federal response to this, because you brought this up with avian flu more than a year ago.
Yes, it's very concerning. We no longer have the Office of Pandemic Coordinator in the White House. The Department of Agriculture, which inspects and gets us a lot of this surveillance data and information from farms, and a lot of those people have been laid off, and some of them were accidentally laid off. I don't know how many of those have come back, but then also on the CDC side, those epidemic, we have a team of the most highly trained epidemiologists and scientists that respond to new disease outbreaks, and that department has been decimated. So we don't have. We have the expertise in the United States. The problem is we fired most of them. And so this is very scary, very dangerous that we don't have these people in the event this does start taking off. And it also means that it will start taking off and we're likely not to know it until it gets bad. We won't know it as early.
All right. Well, of course, you will keep us as updated as possible. We've been talking with Dr. David Pate, former CEO of St. Luke's Health System and co-author of the book, Preparing for the Next Global Outbreak. If you have public questions for Dr. Pate, send us an email, idahomatters@boisestate.edu. And that'll do it for this episode of Idaho Matters. Thanks so much for listening. And just a reminder, you can find all of our episodes wherever you get your podcasts.
Sources and methods, the crown jewels of the intelligence community. Shorthand for how do we know what's real? Who told us? If you have those answers, you're on the inside, and NPR wants to bring you there. From the Pentagon to the State Department to spy agencies, listen to understand what's really happening and what it means for you. Sources and Methods, the new national security podcast from NPR.